What is the difference between an LPN and an RN? If you are considering a career in nursing, you might be asking yourself, what is the difference between a licensed practical nurse and a registered nurse? Both roles are essential in healthcare, but they have distinct differences in education, responsibilities, and career paths. Let's start with education. A licensed practical nurse typically completes a one-year training program at a vocational school or community college. This program combines classroom learning with hands-on clinical practice. Students learn about nursing theory, anatomy, pharmacology, and patient care. After finishing their training, they must pass the National Council licensure examination for practical nurses to become licensed. In contrast, a registered nurse requires a more extensive education. They can earn either an associate degree in nursing, which takes about 2 years, or a Bachelor of Science in nursing, which usually takes 4 years. The curriculum for registered nurses includes a wider range of subjects, such as nursing assessment, psychology, and pharmacology. They also participate in clinical rotations across various specialties. To practice, registered nurses must pass the National Council licensure examination for registered nurses. Now, let's talk about job responsibilities. Licensed practical nurses provide basic nursing care. This includes tasks like checking vital signs, inserting catheters, and assisting patients with daily activities like bathing and dressing. They work under the supervision of registered nurses and doctors, focusing on patient comfort and safety. Licensed practical nurses may also monitor patients' health and report any changes to their supervisors. Registered nurses, on the other hand, have a broader scope of practice. They administer medications, create care plans, and provide education to patients and their families. Registered nurses can work independently and often supervise licensed practical nurses and other nursing staff. Career advancement is another area where these two roles differ. Licensed practical nurses who want to advance can pursue additional education through LPN to RN programs, which typically involve earning a Bachelor of Science in nursing degree. Registered nurses, with their more extensive education, have opportunities to specialize in fields like pediatrics or critical care. They can also pursue advanced degrees, such as a Master of Science in nursing or a Doctor of Nursing practice. From the perspective of higher education institutions, understanding these differences is vital for structuring nursing programs. Colleges and universities can offer licensed practical nurse programs as a quicker entry point into nursing while providing pathways for licensed practical nurses to transition to registered nurse roles through bridge programs. Additionally, institutions can highlight the importance of registered nurse education by showcasing the broader scope of practice and career opportunities available. In summary, both licensed practical nurses and registered nurses play vital roles in healthcare. However, their education, responsibilities, and career paths differ significantly. Understanding these differences can help you make informed decisions about your nursing education and career goals.